In our SITREP report, we reported 10 positive cases of coronavirus in the community from yesterday. I went through most of those cases of my narrative yesterday. I will be fairly brief today. We've also got a lot of work on at the moment, but I'll touch again on the key features of this outbreak. I can also advise that this morning, in the last couple of hours, we've identified a further two positive cases, both from the extensive testing done around the members' reserve at the MCG on tier 2 or level 2 of the MCC members' reserve. I'll come on to the details of those cases and how they impact things, but you'll appreciate we're dealing with a very dynamic situation here, a very rapidly moving situation here. What we've got is two separate incursions into Victoria over the last 3 or 4 days, two chains of transmission. At least one of those chains is moving very actively and very aggressively across the state. In the last 72 hours, we are now onto our 7th ring of contact tracing across these outbreaks. The first ring was the removalists that were here at the end of last week. We identified them late on Sunday night into Monday morning. The second ring was the families, the people that they moved into the state in the places where they picked up their furniture. The third ring was the neighbours, the residents in the apartment building at Ariel. The fourth ring is friends of those residents and neighbours, at least one of whom has already turned positive. The fifth ring is the families of these friends of people in the Ariel apartment buildings, and again we have at least 2 positive cases in the family ring. The sixth ring is the primary close contacts of those cases. We are testing those people today. And the 7th ring is their secondary close contacts who are all locked down in isolation. So you can see in the last 72 hours, we've burned through 7 rings exceptionally quickly. This is probably the fastest response we've ever seen to an outbreak that's moving more quickly than we've ever seen here in Victoria, or I suspect anywhere else in Australia. Currently, right now, we have 16 cases in total are associated with these 2 chains of transmission. We have over 75 exposure sites, some of them very large and complex locations. We have over 1,500 primary close contacts who are isolating. We have over 5,000 secondary close contacts who are isolating as well. As I say, we've mobilised very rapidly over the last few days, and of course we continue to surge in all the areas. And can I give a huge thanks, particularly to the local public health units across Barwon, across Western Public Health, North East Public Health, South East Public Health. All those teams are now active and working on these various exposure sites and positive cases. I can also give a thanks to the over 6,500 people, Victorians, who are now isolating as part of this outbreak already, and the ongoing work we do with them. Let me summarise briefly the cases that we're dealing with, and now, of course, I'll take questions as usual. For the City of Hume outbreak, we have a total of 5 cases. For those 5 cases, it's a family of 4 with 1 other contact via the Coles QR system. A total of 195 primary close contacts. Over 50% of those have returned a negative test result. That remains an active chain of transmission. My thanks to the whole community in that City of Hume area for their support. We have more work to do with that outbreak to make sure we fully have it under control, but initial signs are reasonably encouraging. The Ariel apartment complex, we now have 6 positive cases associated with the Ariel apartment complex. We have a total of 680 primary close contacts, of which 131 are residents. 104 of those have already returned a negative test result. And of course, we have 4 positive residents. And other primary close contacts across retail, hospitality, the aquatic centre, all identified in the last 24 hours and on the website. We've discussed them before. Of the 6 positive cases, 4 are from the Ariel apartment building itself across 2 different apartments, both on the 3rd level. All those 4 individuals are now in hotel quarantine, and my thanks to them for agreeing to do so. There are no known positive cases at this point in the Ariel apartment building. And 2 positive cases who are parents of one of the positive cases. Those parents continue to live in Craigieburn. They are being well supported and they are otherwise well. We then have the new cluster of 3 positive cases around the MCG stroke Barwon, if I can put it that way. So we have a man in his 50s who is a friend of the man in his 60s from the Ariel apartment building. They spent the day together on Saturday the 10th of July. They took the tram, they went to Young and Jackson's, they took the tram to the footy, they spent the day at the footy, and then came home. This man in his 50s lives in Barwon Heads. He in turn, there are 2 other positive cases now in his household, a 9-year-old child, another man in his 60s, and in turn that collective unit of 3 have exposures to Bacchus Marsh Grammar. There was exposure to a staff-only session on the Monday of this week. So we therefore have 315 staff at Bacchus Marsh Grammar in isolation as primary close contacts, and 3,000 children as secondary close contacts also in isolation. And we have Barwon Heads Primary, another exposure there, 49 staff and 527 students as a combination of primary and secondary close contacts. Again, my thanks in particular to Barwon Health. They've mobilised exceptionally well around the Barwon Heads Primary. There's a wider team supporting Bacchus Marsh. We've got local testing set up. I think the school community has been fantastic and really good support from the school authorities, and my thanks to them. I know it's such a distressing and complex time to be dealing with these outbreaks. We are working, of course, to get the primary close contacts tested. And as soon as we have that information the next day or so, it'll allow us to get a more informed position on how we deal with the schools going forward. The 2 new positive cases, so that's 5 at the City of Hume, 6 at Ariel, 3 in Barwon, and then 2 new at the MCG. At this stage, and bear in mind this information's come out literally in the last hour or 2, are 2 people who were also at the football. They were both sitting in level 2 in the members' reserve at the MCC. We do not believe that they are known contacts of the other 2 positive cases that we know were there. Of course, interviews are ongoing with those individuals as we speak. There will be other exposure sites we work through, and as we have more information, we will of course continue to share it, as we always do. Late last night, the Chief Health Officer confirmed that we are now back to mask wearing at indoor settings, I think for fairly self-evident reasons. One example we will give you on this particular outbreak is that the removalists who were in the Ariel apartment building, the man whose furniture was being taken away, who spent 4 or 5 hours with these removalists, was wearing a mask. The removalists were not wearing a mask. He is not yet currently known to be infected. The 4 other people who were in that apartment building, 1 direct neighbours, 1 elsewhere on the floor, were not wearing masks, and they are positive. We know that masks work. There will be future opportunities to speak to my public health team about why masks work. I won't go there, but we have decided to immediately implement that basic measure because we know it can make a significant difference at very low cost. Please, I would urge again everybody, we've got 6,500 people who must get tested. They will all have been contacted. Please do so. It is so important that we get our hands around this as quickly as we possibly can, and we can see now how fast this is moving through those different rings and through those different links across the community. We have additional testing sites set up. The details are on the website. Showgrounds is now set up to a full 8 lanes. We've got additional pop-up sites at Bacchus Marsh and various other locations. I'd urge you please to make good use of those testing facilities. 27,000 tests yesterday, that's a pretty good start. We'd obviously like to see significantly more testing in the coming days. As I say, I appreciate it's not the news that any of us wanted to hear today. We have an ongoing dynamic situation. There's obviously a lot of work to do for my team behind the scenes, and that is continuing to happen. And my thanks to everybody for their fulsome cooperation, and I'll take any questions. So the team at the moment is reviewing all the data and all the epidemiology, Richard. As I say, this situation is moving not so much hour by hour, but half hour by half hour. Obviously, if we have more information to share, we'll share it.
Are these 2 new cases of children?
One, I believe, is a minor, one is an adult.
And is there any potential that one of those are leaked into false positives?
We have reviewed the CT values this morning. Our sense at the moment is that they are both likely to be positive.
And so were they in the Tier 2 section of the MCC, or were they identified in that Tier 1 the same day as this?
So we believe at this point, and again, information still coming through, that one of them is likely to be in a Tier 1 contact and one of them is likely to be in a Tier 2 contact. And again, so we have 23 people identified. Let me rewind slightly. The man in his 60s who was at the football game, who was the positive case, unbeknownst to himself, he was asymptomatic, positive case on the 10th of July that went to the Geelong-Carlton game, sat at level 2 in the members' reserve at the MCG. There are 2,000 people in that block, registered in that block. They are all Tier 2 contacts. In addition, 23 people were identified as likely Tier 1 contacts because they sat in close proximity with that individual. We've asked all Tier 1 and Tier 2 to get tested as a matter of urgency. We saw a really good response on that yesterday. My thanks to everybody who did that yesterday, particularly those MCG contacts. I believe at this point in time that one of these contacts is likely to be in a Tier 2, in the Tier 2 area rather than Tier 1.
Is that Tier 2 exposure really putting us in a very serious situation?
Yeah, look, I think both these cases put us in a serious situation. The situation we were dealing with when we stood here 24 hours ago was that all the contact at that point, up to that point, had been between people who had spent significant time together, who were known to each other. Again, the interviews are ongoing. Our initial information is that the 2 new cases we have today are not known to the gentleman from the aerial. That, of course, gives us significant cause for concern.
Are they known to each other?
Rachel?
Well, the 2 new
No,
cases-
again, I believe based on where they were sitting in very different parts of the ground. There's no obvious relationship between them at this point in time. Of course, you know, the interviews and discussions are ongoing. It may well be that there's that they're part of some other group, but we do not believe so at this point in
And
time.
are the adults linked to those gym exposure sites we saw in Point?
Yes, that's right. There's a couple of gym exposure sites, and one of those cases is linked into the gym sites. That's right.
So on the MCC, that would represent 2 separate cases of stranger transmission at that day.
So potentially, and again, and this is always the hazard. So I'd ask us all to you know, continue to look at the emerging picture rather than focus too much on individual details at this point. But yes, the emerging picture, based on the information I've had for the last 90 minutes or so, is that this is possibly 2 examples of stranger to stranger transmission between the individual that we know about and these 2 new cases.
The infectious man who went to the footy also went to Young and Jackson.
Yep.
People wouldn't have been wearing masks in that environment
Yep.
on Saturday afternoon.
Yep.
He also caught public transport. How
Yep.
worried are you about those other?
Yeah, look, we obviously look, and we're obviously concerned. That's why the list is exposure sites. That's why we encourage people who've been to those exposure sites to come and get tested. So we're comfortable that we understand the relationship between the man from the aerial apartment and the man from Barwon Heads. They're friends. They had a good day together. So their transmission is well understood and explicable. As you say, Rachel, obviously we have concerns about the fact that we know this one individual was, you know, significantly infectious. He has infections to his elderly parents. He's infectious to his friends. There may well be other infections to these 2 cases that we've identified at the MCG. Yeah, we'll get more information about that over the coming hours. And of course, you've got other exposure sites that he's been in, 2 tram trips at least, a train trip, Young and Jackson, and a number of other places. So that is why, obviously, we're concerned. That's why there is a huge effort going on, literally thousands of people now working across these 2 chains of transmission to try and get it into, to get a good sense of what's happening out there. And please, my message to Victorians is, you know, we need to understand as much of this transmission as possible. We need you to come and get tested.
You said that chain of transmission is going through quickly. We've obviously
Yep.
done a lot of work in the last 72 hours, but
Yep.
are we moving fast enough? Will we catch it?
Yeah, look, I think we're moving as quickly as we have ever moved, and I think we're moving as quickly as I've ever seen any contact tracing operation to move in this hemisphere, at least. So, look, I think we're certainly confident that we're right on the heels of this particular outbreak. The areas of concern for us, what do we need to find out in the next 12, 24 hours is, what we've closed down, let me put it this way, we've closed down the aerial apartment building. We're confident that we've got our hands on that. There's no more risk of leakage from aerial apartments. And again, my thanks to the residents who are in the building. Spoke to many of them yesterday. We've obviously now, our real focus is the MCG. We've now seen, likely to have seen at least 2 cases, possibly 3 cases of transmission between the man in the 60s and the 3 other people we know are there. We now are positive. We need to establish whether there are any other people who are at the MCG if they're positive. That's a critical bit of information we need to get to today. Many of those test results are continuing to come in during the course of this morning. If you're getting those Tier 1, Tier 2 text messages and you haven't got tested, we need you to come and do that now. Whatever you're doing at the moment, stop doing it. Please come and get tested so we can get that information and get you safe and secure. We then, of course, got a lot of work happening today with the schools, both Barwon Primary and Bacchus Marsh Grammar. Again, we'll get a lot of information about whether we've seen any risk of transmission there. Those are the critical bellwethers at this point in time. And the 4th one will be the various retail and hospo sites that we've listed if we're seeing transmission in those locations. So, as I said yesterday, it's this next 24, 48 hours. That's a critical period to see whether this is a wave that's standing up on us or whether we're already cresting over the top and we're just running it into the ground. Right now, I don't have that information, but we will have a better picture in the next 24, 48.
Are you confident that you've been able to contact everyone who was in that MCC mechanism? How long did you pull out all the
Yeah, look, good question. Look, and again, this is the power of the QR code system, and the power in particular, and a big shout out to the MCC and the AFL, to the effectiveness of those ticketing systems. That's why we're able to get messages, text messages to all those recorded phone numbers yesterday. That's why we talk to yourselves and we get the message out through every single channel. So I'm very confident that we've managed to get hold of people, unless their phone's dead and they're living under a rock, about that exposure and the importance of them getting tested. So we'll keep going with that. So I'm confident around that. I think we've seen a good response yesterday. I'll have a better sense during the course of this afternoon and evening as to how those negative results are coming in against people who got tested last night. Again, our testing system is delivering all those results 99+% of the time within a day, 95% plus of the time within 24 hours. So the picture will build very rapidly, which will be critical for our public health teams in terms of how we go forward.
What is the health status of the people who've been diagnosed so far, particularly that 89 to
Yep.
90-year-old couple?
Thank you, Rachel, because I did miss that on my summary. I apologise. So at this point in time, we have nobody in hospital around the community outbreaks, which obviously is good and encouraging news. The health position, the health status of all individuals at the moment appears to be good. The elderly couple continue to live at home and are being supported by the local public health team.
Do we know whether anyone's been vaccinated?
I don't have the details in front of me. I believe one of the elderly people has had one dose of vaccine. I can't tell you which one, I'm afraid, or it's AstraZeneca, not which individual. We know that some of the others in this outbreak have also had some vaccination status. I'll update on that maybe tomorrow. Rich? Oh, great, done.
Do we know what areas these cases are from?
Areas in terms of?
Like local government?
Oh, I don't have that information yet, I'm afraid, Mitch.
And the people that were in MCG, do they include staff? Is staff getting tested?
Yes, that's right. So sorry. Yep.
And did they work the next day?
So the staff. So yes, I mean, again, the staff are part of our primary close contact definitions. Absolutely. So one of the way we'll operate this is that our focus is around making sure that all those individuals get tested. We're starting to identify their secondary close contacts where that's relevant. Again, I don't have the details of the shift system of the MCG in front of me or in my head, but we'll ensure that anybody who is locked down, if they have got further exposures, we'll extend that ring to them.
So 2,000 close contacts going out into 30,000 at a time
Yep.
a day. I mean, can you give us any indication that could spread like wildfire?
Oh yeah, look, we're not going to use any. We don't with an outbreak that's moving this quickly, and with the 7 rings I've talked about that we're already on to after 70 odd hours. I don't need to give any more hyperbole around how fast this is moving on the.
How many more cases you could see in that?
Well, look, again, let's go about this in the structured, constructive, orderly way that we've always done. We're moving very quickly around that. We've got over 6,500 people now locked down across all different fronts of these 2 chains of transmission. I'm confident again that one of the reasons we need to ensure that those 2,000 people, the primary and secondary close contacts, are locked down, and also starting to lock down their wider relationships. Again, if people get tested quickly when we ask them to get tested, we get to that next ring really quickly and ahead of it.
Sorry,
So,
in terms of people not complying with QR codes and all of that?
no, not particularly. I mean, generally speaking, one's always, the safeguards we have as a community that allows us to deal with positive cases in the community is 2 fundamental things. One is QR code records, as we've already seen with the case in Coles. It's so important to be able to get hold of people quickly. Read the earlier question, it's allowed us to get hold of 6,500 people really quickly to say, you are a close contact, you need to isolate, you need to get tested. If people don't use those systems, we can't get hold of you, and that's where you start to see slippages. So generally speaking, that's really important. All the evidence we're seeing at the moment is that QR code compliance is far higher than we've ever seen it. It can always be higher. I'd always encourage people to do more. And just one other illustration as to how fast we're moving and how fast this is moving. We had the positive result for the gentleman in Barwon Heads who went to the football late afternoon yesterday. By early evening yesterday, we already had the test result status of his family, and we identified 2 further positive cases. That's how fast we're moving on this one. That's how fast we're moving through those rings. But as we can see with this virus, and as we can see with this Delta, we've got to keep going at that speed.
People have come forward from the other, I guess, outbreak, the other week, for one of the Redstone families.
Yep.
Who came down cold, said one yesterday.
Yep.
How many people have been identified as potentially at risk
Yep.
during that supermarket? What sort of turnaround?
Yeah, so we've got a total of 195 primary close contacts across that outbreak, Rich, and The most significant exposure site is the Coles at Craigieburn, because that's the hot spot for that area. So we've seen a really good response on that. Over 50% of the people who are associated with that outbreak have already returned a negative test result. I know more have got tested recently. And again, just to highlight, we're confident with that particular exposure site that what we're seeing there is we are seeing transmission. We think they spend a bit of time together to achieve that transmission. We haven't yet seen, just on Coles, although it was picked up on the QR code system, we haven't seen stranger to stranger transmission. So the individual who returned positive was known to the positive case that visited the store. That happens. I often see friends in the store. So we know it was longer than casual fleeting contact. That was not the case in the Coles.
Okay, so that's a cold, sorry, the cold was a new example.
That's right. They ran exactly right.
So does that give you a little bit more confidence? Because yesterday we...
That's right. That's right. So certainly, as I said, I think we've got two chains here working. I've got a chain, the City of Hume chain is something where, at the moment, based on what we know today, the contacts are well understood, well established, and likely to have been, known person to known person. That is a little bit more stable at this point in time. Of course, you don't know what you don't know. It's the other chain moving through the MCG, moving into Barwon, that is moving far quicker and potentially operating on the basis of people who don't know each other.
Just to confirm with the aerial apartments, the COVID people being moved out.
Yes, that's right.
There should be no risk for evidence.
That's right. As I said earlier, so we moved both residents of the two the 4 residents of the 2 apartments have all agreed to go into hotel quarantine, and they moved out late last night.
And you've seen how much work you've been able to do in the last 7 years, everyone's compliant with contact tracing at this point?
Yeah, absolutely. Look, I mean, there's always some dramas when you've got 6,500 people you're dealing with. I'm sure there will always be there's always a mix of people who are not as available as we'd like them to be. But no, look, again, response we've seen in the community on this outbreak continues to be very strong. We're seeing a good response in terms of people, the primary close contacts coming forward and getting tested and doing the right thing. So right now, we're pretty comfortable with that. Around 350 home visits done yesterday of particularly red zone arrivals. That's been our focus, obviously. Again, I think we've got literally a small handful of people who weren't doing the right thing, and they're being dealt with by the relevant authorities.
And can you tell us how many people contact tracers are working on right now? Is it hundreds? Is it thousands?
Literally hundreds. So we have, as we did at the beginning of May, we have surged in a number of additional contact tracing resources. We have many hundreds contact tracers working across both our central teams and in the teams in the local public health units.
For the MCG, is this the first case that we've seen of outdoor transmission in Victoria?
I'd need to go back and check the records as to whether it's the first ever case of outdoor, and I think the answer will be no. Certainly, it's not the first time we've seen a positive case at the MCG. We know that. Look, and if as we get through the afternoon, as we get more information about the 2 new positive cases at the MCG, it's likely to be the first case of evidence transmission at the MCG. Look, we've worked very closely with the AFL and the MCC. They've always worked exceptionally well around their controls and their ticketing system. So again, we get comfort from the fact that we know who was there, we know how to get hold of them, and we'll expect people to do the right thing. Rachel, and then sorry.
You're standing up this afternoon. We don't have a political leader with you. Are they all in meetings, and can we perhaps expect an update from them on restrictions later today?
Look, again, I don't. With due respect, my job's to run the response. I have, and they'll be doing what they're doing. Look, the focus for this morning was to provide an important operational update on how we're going with the response, on how we're dealing with some really important lines of inquiry. Obviously, we're continuing to brief government. I do have a meeting with government later on today. They'll make announcements as government decides it's necessary.
Can I ask you about the removalists, Jeroen? The South Australian government says that they've actually been forthcoming with information.
Yeah.
Do you have any idea why that hasn't been the case with Victorian authorities?
Yeah, look, again, as I said yesterday, look, we've got collectively a huge job on, and to some extent they've lit the fire and they've cleared off, and we're now dealing with the consequences of that. So, my time, energy, and sympathy for dealing with that line of inquiry is pretty low at this point in time. So I'll go there once, but no more really. We've got we're clearly working closely with our colleagues in New South Wales. They've also got far more important things to worry about than the removalists, and our colleagues in South Australia. My understanding from some of those discussions is that we're seeing similar concerns in all 3 jurisdictions around lack of sufficient information provided early and properly, I think you'll note from South Australia they were also asked to list late some exposure sites subsequently from the first tranche. So I think we're seeing a fairly consistent pattern here. I've handed the file over to my enforcement colleagues and to other interstate jurisdictions for them to explore as is necessary. I don't need to, frankly, we've all got more important things to do than to worry about them. The wheels of justice will get to them as and when they need to.
Do you have any idea what the problem was? Was it a fear of punishment? Was it a language barrier?
Let me focus on the fact that the whole principle of the safe and effective movement of freight over sensitive state boundaries, one of the most important things we can do. But a number of conversations with the freight industry this week, these people do critically important work, and we're all busting a gut to try and support critical industries to keep going when we've got significant challenges in New South Wales and significant risk of incursions into our state. So we want to do the right thing, and I know the freight industry wants to do the right thing so we can keep food in our stores and do all the things we need to do. So they're as disappointed as we are that we're seeing what I would probably describe as loosely as a rogue operator who isn't doing the right things and isn't complying with the restrictions that the industry itself has agreed to comply by. My beef is not necessarily with the individuals. I understand people have all sorts of challenges to deal with, but my beef is with an operator who doesn't then comply and support the work of the health authorities in 3 different states to get to the bottom of an important outbreak. So, Rachel.
This rogue operator has potentially put the livelihoods of thousands of other businesses at risk.
Yep.
Why won't you name them?
Because again, I'm moving this on to our enforcement authorities and to other interstate jurisdictions. They can deal with that as appropriate. I'm not judge, jury, and hangman. That's not my role. My role is to deal with these outbreaks and to deal with the consequences of these people's actions. And as we've always striven to do in Victoria, we're not here to be punitive. We're not here to punish people or to make life more difficult. So I'm just not interested anymore, frankly, in dealing with them. They've done the damage, we're picking up the pieces, and we'll get on with that.
When you say you've given it to enforcement authorities, do you mean police?
Including the police, yes.
And do we know how they got from South Australia to New South Wales? Did they come back via Victoria?
We don't know, actually. It's a good question.
New South Wales has...
Maybe they went to the NT. I don't know. I mean, seriously. Actually, you know what? I'm not going to... I've got so much to do today. I'm not going to go there anymore. So I'll deal with any other questions apart from rogue removalists.
Quickly, New South Wales has named an exposure site at Indira and
Yep.
Albury linked to these removalists.
Yep.
It's pretty close to the Victorian border.
Yep.
Are you worried about any potential...
Yeah, of course. I mean, and
exposure?
I'm worried about it as an Australian. I'm worried about it as a citizen of this country. And I'm worried about it because it's close to our border. Of course we're worried about it. It's part of the same pattern. And look, and I think let me flip the whole thing around. Let me just call out and say, we've got, I believe, in the order of 15,000 freight movements, across our borders, who keep our industries going, keep agriculture going, keep us fed and watered and all the rest of it. That's a really important job to do. We put significant pressures on those organisations and on those freight drivers to do the right thing, to comply with rules and testing regimes that are fairly onerous, and they're all doing the right thing. So, look, we're all tired. We've all had a lot of work to do, and we've all got other things to worry about. So, it just tests the patience a fair degree when you have to get into that. So, okay, so Rachel, with all due respect, I answer just about every question here. I ain't got time to deal with it. So I'll deal with any other question.
On red zone permits,
Yeah.
do you make any recommendations to make them tougher or stricter, or do you think the system is working well at the moment?
Oh, look, I think we've got over 9,000 Victorians that have returned on red zone permits, as we've seen with the family in the city of Hume. It's exceptionally important to comply with the obligations, and we really want to ensure the Victorians can come home safely. I would reflect on the fact that it's been over 3 weeks now. I think we're getting onto the 4th week of the Sydney outbreak. We've been saying consistently since the middle of June, come home. We've been saying since the middle of June, don't go to New South Wales. It's a high risk. It's been a red zone now across that whole state for 5, 6, 7 days. So please, if you're a Victorian and you're still in New South Wales, time's ticking. You've got to get home. We cannot deal with this growing risk of the situation in New South Wales. I strongly, when I've got 6,500 people who are currently isolating in Victoria,
facility there, like
Yep.
a football team can you run us through the dangers of that, what you understand?
Yeah,
Why
so,
is that an exposure?
so my understanding at the moment is the barman man who tested positive late yesterday afternoon, his a 9-year-old child in his household, plus a gentleman in his 60s also in his household, have connections to the footy club, Barwon Heads Footy Club. I think we've updated the listing for that recently just to give a bit more extra information to correct, I think, an earlier mistake. So that's the exposure. We believe one of the members of that household, I believe it's either the child or the older gentleman, have had contact with the Barwon Footy Club. That would have been in the last few days. And remember, we're dealing here, unlike many previous outbreaks where we're dealing with things a week ago or 10 days ago, we're dealing here with exposure and contact literally this week. So the Barwon Heads man went to the footy on the Saturday, the 10th, and here we are on Thursday morning talking about not only his exposure, because he was COVID free when he went to the footy. We're now not talking about him being positive, but also 2 other members of his household being positive, and the knock-on impact to other parts of the local area.
Does the wastewater testing that we've had back from
Yep.
Barwon account for these 3 cases, or do you fear there's more?
No. Look, we've seen some recently some positive detects in the wastewater in the Geelong area, in the Barwon area. That clearly builds and is consistent with a picture of picking up these 2 positive cases. What wastewater testing doesn't tell you is whether you've got, I make it up, 10 people in the area who are COVID positive, or whether you've got 2. So that's why, again, it gives us a good indicator about where we've got concerns and exposure. It doesn't do the heavy lifting of then doing the contact tracing.
My understanding is from the Chief Health Officer's press release yesterday was that wastewater test results, actually the first period was from the 4th to the 7th, so before the removalists came to Victoria, before the Red Zone family came to Victoria. Does that, it could be shedding obviously, but
Yep.
is that also a possible indicator
No,
of another chain of transmission that we don't yet know about?
No, we're really confident, Rachel. Again, bear in mind we've seen really strong testing levels across Victoria over the last 8 weeks. I mean, really going right back to that to the South Australian incursion all the way back in May, and our own Delta outbreak. So we've seen a lot of shedding going on, of course, but we've seen really high testing numbers. So we're really confident that we're dealing with these 2 chains of transmission. The only caveat I will give is, what I don't know is what other incursions might have happened in the last 4 or 5 days. If they haven't come forward to get tested yet, that'll always be the unknown we have to deal with. That's why it's so important that any of us, no matter where we are in the state, no matter where we've been, if we're symptomatic, we just must get tested. We cannot assume that it's hay fever or a cold or anything else. You just have to assume, because you don't know where the exposure's been.
Just to be clear though, that sewage result was the Chief Health Officer's press release incorrect yesterday to say that was from the 4th to the 7th?
No, I don't think it was. I must admit I don't know those details in my head, Rachel, so I'm happy to take that on notice, but I'm pretty sure that's right.
Have you spoken on Premier this morning?
Rich? Not personally, no.
The reason he's not here with you?
No, I don't. Look, in the nicest possible way, I don't hold the Premier's diary, and the Premier's got a whole state to run. My job this morning is to give an operational update on how we're dealing with the coronavirus outbreak. That's my accountability as to how we deal with that response, and I think I've been pretty fair dinkum with you guys in accounting for that.
On the vaccine,
Yeah.
both in terms of this outbreak that's happening now, but clearly there's just always an ever-present threat with
Sure.
outbreaks in other states. Is there any consideration towards following New South Wales and shortening the gap between the 2 doses of AstraZeneca?
Look, not at this stage. Look, we've always taken a position, somewhat challenging though it's been from time to time, to follow the guidance of the target, to stay within the national framework. And look, we absolutely sympathise with Australians in terms of the advice around AstraZeneca in particular. It's been a bit of a moving target, I know, for many of us. But look, ultimately we will always go with the target advice. At this point in time, we are dealing with a very small number of cases in our community. We're of course extremely focused on that and about addressing that. I would encourage any eligible Australians who are able to get vaccinated to get vaccinated. As I said yesterday, we released an extra 10,000 Pfizer first dose slots for this week. We released an extra 20,000 Pfizer first dose slots for the next 2 weeks. Those are, some of those will still, I'm sure, be available. I'd urge anybody 40 and over who's eligible for Pfizer to come and get those. We've made some more doses available to priority groups, and of course AstraZeneca remains available to those aged over 60. Anybody who is under the age of 60 who wants to explore the AstraZeneca route, I would urge you to go and talk to your GP and get the advice that's right for you.
When I
Look, I
go
don't-
to schools, just quickly,
Yep.
you sounded like the hundreds of school kids that have gone into isolation are all secondary close contacts. Were any
That's
of
right.
them actually in a room with a positive case?
So my understanding at this point in time is that with Bacchus Marsh Grammar School, that all the children are secondary close contacts. The positive case who had exposure on the Monday at Bacchus Marsh Grammar was an inset day. There were no kids in school that day, I'm told. So the exposure for them will be secondary close contacts. And again, that's the rings of rings approach we've always taken. 7 rings is a bit of a record in 70 hours, but we'll go with it. But so yes, that's how we've done it with those kids. Barwon Primary, the 9-year-old child who's in the Barwon Heads household is a student, I believe, at Barwon Heads Primary School. So those children in that school are potentially direct close contacts.
For the parents
Which?
of those, what are the requirements for close contacts with Tier 1 contacts?
So the requirements would be really straightforward. So the requirements around particularly parents of Barwon Heads Primary will be, we're asking you to ensure that your child is isolating and that you are isolating. And there was a good briefing sent out last night by Barwon Health to the school, and the school community is working very closely together. So anybody really in the Barwon Heads Primary School community, if you've got a child at that school, we're asking you to keep yourself and your child isolated, go through those testing protocols for your child, and then as soon as we understand where we've got to with that and which positive cases we may have, then we can make decisions about releasing the rest of the family. Bacchus Marsh Grammar is a little bit different. The children are secondary close contacts, so they're on the outer ring. Of course, we'd ask the families just to minimise their movements while the testing regime takes place for the staff. As we hopefully we can start to exclude the staff from potential transmission, we can exclude the secondary close contacts and move on.
Really quickly on the MCG,
Yeah.
in light of the new case who was in a Tier 2 area, will you be reclassifying who's Tier 1 and who's Tier 2?
Possibly, Rachel. So again, one of the bits of work that the Chief Health Officer team is doing at the moment is reviewing exactly that as we get more information, as we go through the interviews, as we understand how the virus has moved around in some of those settings. As we've always done, we may upgrade sites from Tier 2 to Tier 1. We may downgrade some other sites as well.
Will you release the bays that these people were in?
Yeah, we'll release the information. Yeah, as we always do, we'll release as much information as we can. My shout out now for today, though, is it's all around this. The MCG, as I said, half an hour ago, is a critical exposure site for us. We're really focused on that MCC Level 2 reserve. Of course, anybody else who went to that game, if you went to the Carlton Geelong game on the 10th, and if you don't feel well, or if you're not sure where you were on the ground, and you're not sure whether you gave us the right phone number, well, then just go and get tested. There's no negative consequence from getting tested. We'd always ask you to please, out of caution, get a test result and let's see where we are.
We reckon the New South Wales Premier's description that Victoria wasn't successful in suppressing the virus last year.
I didn't hear that comment. Not from you, I heard that, but I didn't hear it. Yeah. Next question.
Look, I know you don't want to talk about isolated incidents, but there has been a lot of discussion this morning about penalties imposed for those not complying with Health Directive. We wouldn't be in this position here if it weren't for Coles.
Sure.
I mean, legal, enforceable action. Can you give us any indication if that will change?
No, look, I think again, it is always a balancing act, and we've been on all parts of that journey before. So my message to the community is, and my message to people who are doing the hard thing we ask them to do, 40 days of isolation because you're a primary close contact. We've got over 1,500 people now doing that right now. 40 days of isolation because you came out of a red zone and you probably came back at a time you didn't want to. Again, a challenging thing to go and do. We understand that those are real difficult things. That's why we put all these provisions in place. That's why the level of support we provide, as you can see at the aerial apartments, is there to make that as easy as possible for people to comply with. That's why the financial schemes are available to provide people with support to go and do all that. In those cases where people willingly and purposely put the rest of the community at risk by failing to comply, we will of course explore enforcement action. I think only yesterday or the day before there was a $5,000 fine issued to an individual who was breaching a set of conditions. That's not something we want to do. It's not something we get any pleasure out of doing, but sometimes clearly you have to deal with that kind of egregious behaviour. But the real message, particularly for those people who are important positive cases or primary close contacts, by far the more important thing, by far the more valuable thing, is to get the right information from them of what they've done. It's a conversation with your doctor. That's the analogy, and I cannot afford for anybody to have any concerns about, well, if I tell them what I really did, the next thing I'm going to have is a load of enforcement action about that behaviour. That's what stops the community from being safe. So we'll always pull back from
But
that.
it's purely based on goodwill at the moment. I mean, now that we've seen that there's been these 2 breaches, surely don't we need something a bit more enforceable?
No, I really don't think so. And I think I think we get the balance about right. I think again the overwhelming majority of people, when they're in the crosshairs, where suddenly through no fault of their own in most cases they turn COVID positive, and suddenly you've got a bunch of contact tracers landing on your phone line, wanting to know every intimate detail of what you've been doing for 14 days. And where you've been and who you've been with and what you were doing is a challenging and confronting thing to have to go through. So we want those people to feel confident and secure that the information you give us, what you've done, is only there for the purposes of us taking public health actions. It's a confession with your priest, it's a meeting with your doctor, it is not going to go any further. That's really important, and there is no sort of Damocles hanging over the head. Now, clearly where we find individuals who willingly breach or who knowingly, consciously, deliberately breach their conditions. Again, I ain't going to talk about the removalists anymore, but when we see that kind of egregious behaviour, of course we'll take enforcement action, but those are the very rare minorities. We will not. Victoria got through the last 18 months by working together, by working as one state. We've dealt with multiple outbreaks and always run them to ground, and we've done that because we've had the community on side for the vast majority of the time for the entire journey, and we're not going to start to throw people off the bus now.
If there's a language barrier at play, do you routinely use interpreters in these interviews?
Yeah, absolutely, of course we do.
And did you do that with the removalists?
Yes.
Do you think crowd capacity at the footy this weekend will be reviewed in light of what's happening?
Almost certainly. We're reviewing every setting as we speak, and we'll continue to review every setting as we go forward. And yes, absolutely.
Just a decision for you, Mitch. But would a lockdown help your job right now?
Look, it's not a decision for me. It's not my job to be helped. It's my job to get things done and to work with the community to put a strong and swift response together. And I think thanks to just exceptional cooperation from 6,500 people, that's what we've got. We'll run after this. We'll get hold of it. We've got hold of what we've got hold of. We'll pull up the drains and find out what else is going on out there. It is a very the epidemiology is shifting around continually. We get more information hour by hour. The teams are reviewing a lot of data this afternoon. There'll be more test results that have been coming in the last hour and a half or so. And look, they'll have some difficult decisions to make today and in the days ahead.
On the time between AstraZeneca doses, Target changed its advice this week so that if you're in an outbreak area, you should bring it closer. Are we not in an outbreak right now? Look,
I think with all due respect to, again, I'm not a clinical expert, and therefore I cannot and will not give any kind of clinical advice whatsoever. I absolutely understand the dilemmas that Otago have in trying to hit a moving target of understanding of the AstraZeneca vaccine and the conditions that pertain here in Australia. And I do think we've tied ourselves a little bit in knots here in Australia around the use of AstraZeneca vaccine when you see how widely it's been used elsewhere. As such, my only message about AstraZeneca is please talk to your GP. It's your GP that is able to interpret the Otago advice for you as it relates to you, to your health conditions and where you're living at the moment. Any other questions? No? Good. Thank you all very much indeed.
Thank you.